Hey, Brandon Hettner here again, and I promised you one last short video before the workshop, so here it is. And in the last video, we talked about the different grades or severities of rotator cuff tears, rotator cuff problems in your shoulder. So what we wanted to talk about today is the biggest mistake that people make with those grade 1 and grade 2 problems that end up putting them all the way down to the grade 3 and end up having to have surgery and lost time from work, lost time from activities, and a lot more pain and expense. So we want to make sure that that doesn't happen to you. So what we typically hear a lot of times in the clinic is patient comes in and we start talking with them and they tell us, yeah, I've had shoulder pain and problems for a couple years now, or it's been going on for about 9 months. And really, that's a long time to be dealing with shoulder pains and shoulder problems. And so when we dive in a little bit deeper, we find out that it started off slow and they just had pain maybe when they reached up to comb their hair, and so they started using their other arm. They just didn't use it. Maybe they started having pain. It was a female and she started having pain when she reached around her back to do up her bra or take her bra off, and so she just changed that around and did it in front and then whipped it around. Or maybe it's a gentleman and he had pain taking on and off a t-shirt overhead, so he just stopped doing it that way. He'd take one arm off and then take it over his head. So what happens there is, instead of fixing and treating the problem at hand, you just kind of compensate and you change the way that you do things in life. And so basically what you're doing is you're ignoring the problem. So that's the single biggest number one mistake that people make with shoulder pain and rotator cuff problems, is that they ignore it. Okay, and once you start ignoring a problem like that and you have a grade 1 or grade 2, you ignore the problem and the tendon gets worse and it starts to get a little bit brittle. Okay, so what we hear is had pain for a couple years or 6 to 9 months, and all of a sudden I was doing something one day, went to lift up a bag of groceries and I felt a pop, and now I can't move my arm. Okay, so what happened there was they had that grade 1 or grade 2 and the tendon started to get brittle because they didn't get proper treatment and get it healed, and that pop was the tendon tearing, and now you're looking at surgery to repair that. So the reason for this video is I don't want you to make that mistake. Okay, if you've got that grade 1 or grade 2, let's get it taken care of with proper treatment so that you don't end up having to have an expensive and painful surgery. So that's the single biggest mistake that people make, is that they ignore the problem. They don't come in for proper treatment. So look forward to seeing you at the workshop. I want you to do me one favor. Make sure you write down any questions that you have, because I want to make sure we get to as many of those as possible. And a lot of times people don't write them down and then they forget to ask. So if you've got any questions, make sure you write them down and let's talk about them. I'm sure if you have the question, somebody else has the same question, and we can make sure you get the most out of the workshop. It's going to be really informative, like I said earlier in a video, highly interactive, and we usually try to make them pretty fun. So I look forward to seeing you at the workshop.